Good afternoon, everybody. Thank you so much, Mr. Sir. I think this term that I used with you, I think I'm lucky to get a chance to come here today. You see, this is a term which is not a very, but what does it really mean? As a medical practitioner, I think I saw clips of the quackeries, but the other side of the quackery, which is happening with the educated people now. I mean, this syndrome we often say is because idiot is internet derived information obstructs treatment. So this is what I mean, but it is only to emphasize that how this internet information that patients come across today and gain, sometimes very difficult for us as a physician to tell them that no, I mean, there's so much knowledge is available, and that also is very good. It's enormous. You can sort of anything you click. Even now, AI, you have Chat GPT. I think one of my colleagues said, I wanted to put 10 questions for a examination. So I asked Chat GPT, give me 10 questions. But I mean, that's what we are. But this is in medicine has an issue. Because when you draw so much information from that, इनवेरिएबली क्या होता है कि आपको ये सिम्टम है, आपको लगता है कि मेरे को ये डिजीज है, यू गो थ्रू दैट, यू से कि ये भी है, यू टेंड टू सेल्फ डायग्नोस यार ये प्रॉब्लम है, एंड देन यू गेट इनटू डिफिकल्टी, एंड समटाइम देन द पेशेंट कम विद दिस काइंड ऑफ इंफॉर्मेशन एंड द सिम्टम्स टू कन्विंस देम कि यार ये कुछ नहीं है. It's not easy, sometimes very, very difficult. And some of the patients, mostly people are educated, and some even go through investigations. And so if you don't find a right doctor, I think probably you will go through all kind of investigation, particularly in a corporate sector. If you go and land up, they will do all your tests. So whatever money you have, but I mean that this is one area people must realize that when you read, please confirm with the right physician, is it true or not? Otherwise, unnecessarily, some of the things you will try to correlate with your. I remember when I was a medical student, तो जब पढ़ के आते थे क्लास से ये है, तो कमरे में आके लगता था यार मेरे को भी ये हो रहा है. So then I think gradually come to know what is it. So I think this is one area which I will suggest to people that okay, it's good to gain knowledge, but not unnecessarily get sort of a box. You must try to confirm these facts, and rather I will say you avoid it because that confuses you. It's not very easy. You tend to read so much things. And the other aspect is sometimes you are given a medication and then you go back at home and go onto the internet, Google, and say, oh, itke to itne side effect hai. You don't try to avoid taking medicine without realizing कि अगर आप नहीं लोगे, you can get into more problem. Like hypertensive patients, I mean, अब हर एक ड्रग कोई भी आप लिख लो इंटरनेट में, आप जाओगे आप खाओगे नहीं दवाई, वो कुछ लिख देगा इतना, ये कुछ है, but the person who is prescribing, he is aware of it, that how often this medicine, what are the kind of side effects. He may little suggest you कि अगर ऐसा होता है तो we might have to change the medication. So to confirm with your doctor, and this is one I think we face quite a bit in our practice today, and it becomes very difficult to convince people. The doctor Google, I think, which is also very difficult to tell people यार छोड़ दो इसको ऐसे. अच्छा, अपने देश में थोड़ा एक और इशू है. When you read through this and you self say कि ये हो सकता है, यहाँ दवाई लेना कोई मुश्किल नहीं है. Anywhere outside you have to have a prescription. Here you can walk to the shop and you can ask self-medication, self-diagnosis, self-testing. I think you unnecessarily get confused, get stressed, and sometimes people may get depressed. So these are the issue. I think that is what in medicine we are facing. And this term looks okay. And it may also lead to like a hypochondria. It is very difficult then to convince यार कुछ नहीं है तेरे को. उसको कई बार ये कन्विंस करने के लिए टेस्ट करने पड़ते हैं कि यार आपको ऑब्जेक्टिवली भी दिखा देते हैं कुछ नहीं है, अदरवाइज तो आप सोचेंगे दैट एंड यू गो टू अनदर डॉक्टर, वो कुछ और कह देगा. दैट्स अनदर काइंड ऑफ इशू. एक सोशल मीडिया की और है इशू सर, दैट इज इंफोडेमिक. वो इतने इंफॉर्मेशन डालते हैं. आज वो कोविड में क्या हुआ, देखिए जितना कोविड में व्हाट्सएप पे कुछ चल रहा था, मेरा ख्याल है इट्स वेरी डिफिकल्ट टू टेल पीपल ये गलत है, ये मेडिसिन खा लो, वो खा लो। अभी हम तो क्वेकरी की बात कर रहे हैं, बट उसमें इतनी क्वेकरी चली है। आई मीन, आई डोंट वांट टू नेट पीपल हु क्लेम सो मच कि ये करोगे, यू टेक दिस मेडिसिन, यू विल सॉर्ट ऑफ, so these are the, like in cardiology we face sometime this issue. People sort of tell people, no, you could do this treatment, we can bypass the bypass surgery. I mean, that's one way. I mean, it's very convincing to tell somebody, yeah, we can bypass your bypass. Okay, ये और क्या चाहिए, कुछ दे दो जो भी है. So I think it's very difficult. These are the kind of things people have to be made aware of. These kind of the social things which come, and I think they can confuse people and unnecessarily create trouble for people. So I think it's very important whenever you sort of go through the इंटरनेट, इज राइट। आई थिंक इट्स वेरी नेचुरल आल्सो। सपोज आपको किसी ने कुछ कह दिया है, घर में कोई है, यू लाइक टू गो, वो सामने आपके अवेलेबल है, बट टू एनालाइज इट इज नॉट इजी। only a trained person can analyze it. So I will suggest that I think kindly do go through it, but don't unnecessarily get convinced what is written. You must clarify with a good doctor that sort of what is the right thing or not. The other thing that we are facing today is the wearable devices. एक ने वॉच पहनी हुई है और वो कुछ कभी इतना हार्ट रेट हो गया, इतना हार्ट रेट हो गया। सो समथिंग यू टेल द पर्सन, यार इसको निकाल दो, because body is nabi is, we are never in like a stable. I mean, what are you thinking, what are you doing? The pulse may go up and down, and sometimes they get so confused, it becomes very very difficult to tell people, yaar isme kuch nahi hai. And then I said unnecessarily sometimes we have to do tests to just make him confident. So these are some of the modern quackery issues.
Thank you so
that
much.
I think
Very
as
insightful.
compared to